It is my pleasure to introduce our speakers today. We have Beth Howlett, who you've already heard from on today's call. She's the Education Working Co-Chair and Vice President of Communications and Academic Services at OCOM, and she'll tell you more about herself when she introduces herself. And Diane Mastnardo, who is also on our Education Working Group and the owner of Mastnardo Massage Therapy and founding director of Massage Northern Ohio, and maybe she can give another word or two when she's introducing herself. And I don't think Candice is on the call, but she is a director of library services at OCOM and worked with Beth on this presentation. So let me turn it over to Beth and Diane now and make sure that they are unmuted. And thank you so much for preparing and giving this presentation. Then we'll have time for discussion afterwards.
All right, this is Beth. I'll start because Candice is actually here, so we'll both introduce ourselves. We're kind of going to work in tandem through our slides, and then obviously Diane can introduce herself. So I'm really, really excited to be giving this presentation about our research culture here at OCOM. I've been a student at the college since 2005. I'm working on my doctoral requirements. I'm a faculty member and also staff, so I'm going to try and bring in all of those perspectives. It was interesting in preparing this how much of the curriculum that's described in the publications we're going to talk about are actually classes that I took as a student. So it's been interesting to reflect on this journey from actually participating in the single exercises to looking at it as a matter of curricula. And I'm happy to partner with Candice on that because she also teaches in our research area, and so I'll let Candice introduce herself.
Ooh. Hi, yes, my name's Candise Branum. I'm the Director of Library Services. I work closely with Beth, and I've been at OCOM for quite a while. I do not have an acupuncture background. I am a librarian and a sociologist. So I'm coming to this research with a non-acupuncturist eyes, but I've been with OCOM for quite a while and have come to realize about all of the issues regarding acupuncture research and trying to get students to engage with that and not become disassociated with all of those issues.
So it's Diane Mastnardo. I'll introduce myself really quick. I have been a massage therapist since 1999 and basically got frustrated with seeing all the potential we had without having some research basis. So started a practice-based research network through the Clinical and Translational Science Collaborative here in Cleveland back in 2014. So we'll talk more about that in the presentation.
Awesome. So I think me and Candice's slides are first, so I'll just sort of jump right in. This is basically the topics that we're going to cover, sort of looking from the inside out. So I'm going to start really talking much more about the specific resources of our institution and how we handled it when the APRE grant ran out, our 25 grant that I'll go into, and how we managed to sustain culture 8 years out from not having that funding anymore. And Candice is going to talk more specifically about some of the things we learned under that grant around student attitudes towards research, and then we'll talk about where we find ourselves now, both in pivoting what can be difficult conversations with students, and also just keeping a vibrant culture that's organic. And then at the end we'll be talking about PBRNs, and we have our own, so that'll be a sort of point of transition. If you could do the next slide, Beth. So I'm not sure how many of you are familiar or have checked in with Pearl, which is one of the Collaborative's fantastic online resources where numerous institutions who are members of this collaborative have all of their papers gathered together, as well as a variety of other tools about the R25 grants that a number of our institutions received. Portland was really lucky in the sense that there were two segments to these grants, some of which were given to biomedical institutions, and Oregon Health Sciences University, OHSU, received one between 2000 and 2003 to enhance their own CAM curriculum. And then shortly following that, we, among several of our peer institutions, University of Western States, and UNM also received a practitioner research education grant to enhance literacy at our institution. So we had sort of a hotbed and a hub of multiple institutions receiving these research literacy enhancing grants, and the activities that those spurred over an almost decade-long period. And I've put the URL for where you can find all the publications. I'm going to talk more about OCOMs, but there's a ton of resources on the collaborative website right there. So next slide, Beth. So we received the grant to ultimately develop a set of research competencies, and we received it in tandem with going through a process of trying to get regional accreditation. So some of the things that were built, I think, were because we were engaged in both processes at the same time. And even though ultimately developing competencies was seen as the main objective, what we really realized really quickly was how much we needed to train up our faculty. And so I'd say institutionally one of the most interesting initiatives was the Research Scholars Program, where we were enhancing faculty capacity through working with partners and trainers, particularly at OHSU, but some of the other institutions who had received these R25 grants at the same time. And we engaged in workshops and development of particular exercises within different parts of OCOM's curriculum that weren't perceived as being research-based in order to bring in both places where we could evaluate attitudes and also just overall enhance literacy in a domain where students were starting to think about clinical reasoning, but it wasn't obviously a clinical course. So that included things like our Qigong instructor at one point developed an exercise through the Research Scholars Program, as well as the gentleman featured here, Joe Coletto, brought it into a Western clinical diagnosis class where students would evaluate a piece of media, trace it back to its original source, assess the quality of that source, and would do that exercise repeatedly throughout his Western clinical diagnosis class. And so there's a citation there for one of about 3 publications that we put out around teaching research literacy underneath the grant program. In addition, because of seeking regional accreditation, Joe Coletto was encouraged to develop himself as a faculty member, helped develop our faculty ranking system, and through that got connected to Adi Haramadi and developed a mindfulness-based medicine course that we still teach here, and I'll talk about a little bit more with our college research committee, taking that faculty scholarship and turning it into something that we can continuously publish and build around is actually an ongoing effort that I would say started with this scholars program. Next slide, Beth, and I'm going to turn it over to Candice.
So there was a 2006 joint study between NISA and OCOM, who are both R25 grant recipients, and they looked at how acupuncture students feel about research, so like their actual attitudes. Do they think of research in positive ways? Do they see the importance of research? And one of the major findings that we found was that positive feelings, so students enter the program, they have pretty good feelings about research, but as they go through the program, those feelings decline. So students in general feel less positive about research by the time they end the program. And so that was in 2006, and in 2012, I decided to do a follow-up study and see, 6 years since that last study, and since introducing this culture of research into OCOM's curriculum, I wanted to find out if this trend had changed at all. So go ahead, next slide. So the survey, I actually sent it out to 10 nationally accredited AOM schools in the country, and from that we got usable data from 6 schools. So and that was a mix of schools with research programs and without, although schools with research programs tended to respond more than those without, which makes sense. We had 290 respondents, and you can see the years in the program are pretty well reflected. So we have a little more than 50% from the first 2 kind of years, and then like into the intern 3 to 4 year or more, a little less than 50%. The trends, the demographics were the same that we see for acupuncture schools across the country. About 75% of the respondents were female. There was a good mix of age. This was years ago, so we maybe had more older students than we might see in the program now. But there is a good mix of those demographics. Next slide. And so we asked a number of questions, but basically what we were trying to get at is, do students recognize the benefits of AOM research? And the answer was yes, they definitely did. So we looked at some questions like, do they believe that clinical studies affect insurance coverage? You can see, that's like 90% of the respondents said yes, that they believe that. They wanted to stay informed of research. They wanted to learn more about AOM research. These are all pretty high numbers. Feelings about research, a little bit lower, but still, almost 70% had positive feelings about research. Next slide. So this gets into the question that we had from the 2006 study, so about feelings declining. And you can see that the 2012 study, it aligns with the 2006 research. Nothing had really changed in that department. So you can see students, their general feelings about research, very high coming into the program, over 70%. Are excited and interested in research, and then interns, people later on in the program, those feelings go down. Now, this was not a longitudinal study. It was just one capture, and that is some research that we have been collecting the data for. We just have not really put that all together. I co-teach in the first year research course, and Beth does the final year research course, and we've each been collecting our own data, doing this same study basically with the students, so that we can collect longitudinal data, but we haven't really put that together. Do you have something to say about that?
No,
too?
I don't.
Yeah.
Other than, yeah, we're doing it, and when we have more time, we'll do more.
Yeah. And then this other graph too as well, the importance of staying informed about clinical research. It's kind of the same thing, students early in the program have higher agreement that they would like to stay informed than those who are later on in the program. Although that's still a high number for people later in the program. 85% is, I think, pretty good. But you can see those trend lines. And this data, it does make sense, students who are wary of Western medicine when they enter the program, when they start learning about the issues around actually applying the scientific method to acupuncture, this just kind of confirms their bias. They think Western medicine is evil, and this is just another way that, we're being pigeonholed into this program. Students who are excited about research tend to also drop down a little bit because they see that it's difficult to do that research. So OCOM overall, our numbers were a little bit higher than the average, and part of that is because we have billed ourselves as a research institution. So we do get more students who are excited about research coming into the program and selecting OCOM because we consider ourselves a research institution. But those students, even the trends do go in that way. They tend to decline. All right, next slide. So one of the questions we asked was, do you believe that the scientific method for gathering and measuring evidence, do you believe that it's not compatible with the basic principles of acupuncture and oriental medicine? And it looks like 60% disagreed with that statement. So they believe that we can do research, acupuncture research. That does mean about 30% of students don't believe that those are compatible at all. Those are 30% of students who are dismissive, can be dismissive of research in general. And so this quote on the side, this was one of the respondents from the survey said this, and I thought it was interesting because they say, I think that research is critical to bridging the gap between Chinese medicine and conventional medicine. However, much of Chinese medicine can get lost in the research process. It's imperative that as a community we're actively involved in the research process so we can come up with creative ways to research Chinese medicine that helps to retain its essence. So I think we can all agree that that is what needs to be done, and we need more students. We need to encourage that kind of creativity in our students to be excited about Chinese medicine and also still retain acupuncture research and also retain its essence. All right, I think that is me.
Yeah, and I will take it back. And I definitely, as the final year faculty, feel that the steep end of that decline. And so part of what I'll talk about next is the process by which I help them spark that creativity. Can we go to the next slide, Beth? You were good. So I was trying to find an organizational picture that would describe the trajectory we've been on these 8 years later. I appreciate Candice getting another data point, but essentially 8 years ago our R25 grant ran out. And so this image sort of is how I felt about our trajectory. At first we had the great wisdom to have a president, Liza Goldblatt, who hired a director of research. We had this foundation of having a culture that was prepared to receive the money and start to build the framework for that culture. Our second president actually put research into our mission statement for the school. And so when we received the grant, we had that very strong foundation, and then we built out the 3 arms that were necessary: faculty development, student engagement and development, and also staffing. And staffing is key, I think, especially as students turn over. Without that component, ultimately you don't have a stable structure. And where we find ourselves now is still embracing it as our mission, still with staff, faculty, and student capacity, although it looks different because it's not being driven by funding, which in some ways is better. You can be more creative because you don't have to comply with the terms of the funder. And we have these little corpuscles, these different committees and other activities that sort of bubble up, and in the next series of slides I'll talk about the ones that have been most sustainable. So next slide. So the first one, obviously, is we developed a series of competencies out of the grant. These actually hang in a hallway right outside of the faculty suite. Candice and I both reference these in our syllabi and continue to use them and check in on their viability and even look for alternative models. And the collaborative has a great set of competencies that we're looking at figuring out how to combine into our teaching. And you'll see that the last point is to participate in a culture of research. So that is the end game of the competencies that we developed, and something that as the highest order, I guess in terms of sort of the Bloom's taxonomy, in terms of critical thinking and higher order skills, where I'm trying to take students by the end of their final year project. And so first I'm going to ask Candice to speak briefly to what our first year course looks like, which has changed over time, has been rebranded, and we're actually discussing moving it into the future. So Candice, you want to talk about that?
Sure, yeah. So the first year research course, it started off, I mean, it's gone through many iterations. As of right now, it is a 1-credit, 6-week course, and it's co-taught by me and the head of our research department. So it's really nice because students get to see not only the librarian, but someone who graduated from OCOM's research department, or from OCOM's program, and actively does research, talking about research. First day of the class, we show these competencies, and we say, you know, this is what a research literate practitioner should look like, and you should be able to, by the end of your time at OCOM, understand all of these points. So for the first class, it's a 3-course sequence. In the first class, we cover the first 4 points. So students know how to generate searchable questions, they know how to access information, they can differentiate between which kind of information to consider as evidence, and then looking at critically evaluating and synthesizing that evidence. And the second year course also covers a little bit of 4 as well. There's some overlap there.
I'm going to skip over our second year course and get right into the final one where I address all of the competencies but speak much more to 6 through 9. And what I've found is that when I first interact with students in what is essentially an independent study, what I try to do is emphasize 2 points for them to get over that hump of the decline, that declining feeling of faith that they have and frankly the things they're going to have to read and try to pull together into a narrative. And the first thing I do is help them point out really this professional communication component. I think everyone realizes that interprofessional communication, even if it's just, I don't know, writing up a case report because of a motor vehicle accident claim, that we all have reasons why we're going to have to talk to other people about how we're practicing our medicine. So I try and actually activate it almost as a professional development skill versus a research skill. The other thing I do is I try and help them find that creativity through finding a personal passion. So because I work with them over time, at first I say, think of a patient that you're really struggling with that you want to know more about. Think about, oftentimes our students had a medical crisis or something that brought them to the medicine, so they have a really deep attachment to knowing more about that condition. I try and help them find something that they feel really passionate about, because without that, all the work it takes to pull together an evidence-informed project, they lose interest. And I found that to be pretty successful. At this point, they have 3 options. The first option students can choose is to do an evidence-informed presentation, and I request that they imagine their audience as an interprofessional audience. The second option is to support faculty in ongoing scholarly work. The final option is to do their own original research, and they complete that over the course of a year. Next slide, Beth. Great. Another thing that happened as we were trying to institute all of these structures around faculty training and curriculum and whatnot was that to engage in research you need to have an institutional review board. That also really was sort of an outcome of the regional accreditation process. But again, knowing we didn't have the capacity to, 1, have an IRB that meets frequently, and 2, we didn't have a ton of internal research knowledge, so we kind of need to create a stair step before the IRB that we call the CRC. And the CRC still exists, is still thriving, and I would say is one of the greatest unintentional outcomes of this whole process. So 1, it's a venue for us to retain faculty scholars. It's a place that some of our most active faculty scholars meet and form the committee itself. As a person who is always looking for mentors for the OMR class, it's the place where I can do the most frequent check-ins and say, hey, do you want to continue that project? Hey, you were talking about doing this with our clinic outcomes data. Would you like a student assistant to do your lit review? It's just a place where, in the absence of the grant-funded program, we actually have a regular meeting of faculty scholars who are talking about research literacy on campus and how to improve our skills and communications around that. It also is a place where when we have collaborative partners coming from the outside, when they ask me how can I partner with OCOM on research, I have a clear process to articulate to them. So a perfect example is right now, I'm going to get into awesome quickly, but we had a research fellow who participated in a clinical rotation, and after talking to one of our faculty said, hey, I'd like to collaborate in research with you. When he reached out to me, I said, great, let's get you on our next CRC meeting. Let's talk about that, what it would look like. We need to get that to our IRB. Let's make a plan together. And so it's just a place to situate any of those sort of manna from heaven that come to us and say, we'd like to partner with you and use our resources to help you do research. And the last thing I'll say is we developed a clinic outcomes data project, again, out of this period when we had the R25. And the CRC is actually, as the members change, we update the IRB approved research project that is our clinic outcomes data project, and any member of the CRC is allowed to be an investigator with the clinic outcomes data. This allows us, any member of the committee, to mentor or foster either master's or doctoral students who want to do clinic outcomes data work. And if we had hours, I'd love to talk more about that, but next slide. So another fantastic outcome of the R25 was that, as I mentioned, OHSU, UWS, NUNM, and OCOM all received grants. And so we all started talking to each other, and when the funding ran out, we realized, gosh, we really need to keep talking to each other. And so rather than being grant funded at this point, the Oregon Collaborative for Integrative Medicine is its membership by institutional subscription. So we all pay dues to it. It has an executive director, and it continues a lot of the initiatives and energy that came out of that period with the R25. Its board is composed of presidents and executives from all the member institutions. They have really thriving student chapters that engage in a lot of creative and fun integrative activities to bring students from all those health colleges together. They host grand rounds, which are interprofessional panels, and then every other year we do a local research conference and poster session, again, featuring a lot of student-generated research. Next slide.
So I'll move quickly on this one. The Portland Area Health Libraries Consortium is a collaboration between OHSU and UNM, University of Western States, and OCOM. And more recently, Pacific just joined our consortium as well. So each of these institutions have had individual partnerships between each other. So we had reciprocal borrowing set up on a one college to one college basis. And we realized that the four colleges, OHSU, UNM, University of Western States, and OCOM, there would be a benefit to sharing a catalog and making those resources more available to our students. And it would really actually encourage integrative medicine. So students from OHSU would be able to learn about integrative medicine, acupuncture, massage, and vice versa, that schools at those complementary medicine students, that they would have access to large biomedical collections. And so the schools received LSTA, Library Services Technology Act grants that helped us to all get together and get on one system, which is very costly. But UWS did that in 2006, and OCOM joined in 2010. We got a $58,000 grant to do that. And so just recently, within the past year, we realized that all of these members were also awesome members, except for Pacific. And we were like, Pacific meets our criteria too, so let's pull them in as well. So we're still working on getting them into our catalog, but eventually they will join as well. We are not associated with Awesome officially, but all of the members right now are also Awesome members. And one really great thing is, even, this is a official consortium, but all of the librarians and the libraries work really collaboratively. If we have research questions, Jane from Bastyr will call up the other schools and say, hey, I'm working on a systematic review. Can you look at this information? Can you see anything that's missing? So all of the schools are really working together to make sure that the services that we provide and the research that we're doing is the best.
All right, next and last slide. Second to last. So one of the other outcomes is book club, and I know we're talking too much, so I'm just going to glance over this one, but hopefully folks will consider reading any of these books. Right now, I would say Small Teaching has been the most transformational around, again, dealing with that sort of more morale decline among students. I try to use some of those, and they're really evidence-based techniques for how learning actually works, and they're tiny exercises you can add into the classroom. For this year, I actually started with a sort of free association cloud of what is evidence to help students get over that hump of hating research, because in fact there are many forms of evidence they like working with. So again, harnessing that enthusiasm. I think next and final slide. Yes, so out of the R25 period, we also developed 2 online tools that are unique to the institution. One is a PBRN, so we're going to get more into that in a second, and the other is AccuTrials, which is a searchable database. In terms of our staffing, it's much leaner than during the grant period, but we still have a director of research and we still have a data entry person who helps maintain the AccuTrials database. And we use ChiPartner actually mostly for our doctoral program. It's something that students have to engage with in their doctoral degree, and it's part of their learning process about how to write effective case studies. So I'm going to turn it over to Diane.
So on to the Practice-Based Research Network. I kind of come from a different angle. I am a community member, practitioner turned researcher in ways. So I got involved with practice-based research networks by having a question about a study that I did And through the Clinical and Translational Science Collaborative here in Cleveland, they had a consult service in looking at trying to help community members become researchers. So with that, we looked at dialysis studies, or we looked at leg cramping and dialysis because the director of the center was a nephrologist. So on this slide it says the Practice-Based Research Network. I think this definition is different from what I've found over the past 5 to 10 years of people's interpretation of what it is. We really look at trends that are happening, focusing on health, not just what goes wrong, but what are the things that create health and what's happening within our practices. Next slide. So I think the slide kind of speaks for itself, and it's something that really hit me. I felt like it kept running in circles, and why are we pushing so hard when it doesn't need to be so difficult? So next slide. Please. Thanks, Beth. So we created, in 2014, we looked to find some understanding amongst massage therapists in the area, and we had the ability to create a practice-based research network here because the co-director for the Center for Reducing Health Disparities that I was working with also had connections with a shared resource group. So we looked to see, and MassageNet was formed through the Agency of Healthcare Research and Quality, which is another massage practice-based research network. So collaborated with Jalen Chamborg from the Massage Therapy Foundation and got their initial evaluation to find out how they started their program. And since their funding had limited, we were able to tap into the funding here and see if we could create a local branch and just what was happening here, who was interested. We had about 150 people interested. 80% were really interested in research. So we found other licensed massage therapists that were interested in research. So this is the group that we have. Next slide, please. Our mission became to improve access to massage therapy, to conduct research on massage efficacy, and to educate the public, healthcare providers, and policymakers about massage. I think the big thing that Candice and Beth both talked about is changing the paradigm of research. Instead of we're looking at empirical evidence and we've been told that you know, the randomized controlled trial is the best and highest standard, which it may be, but when we're looking at complex problems like pain and stress and anxiety, there's other ways to look at it. And the Practice-Based Research Network model, at least that we have here, that we're utilizing, is very beneficial in looking at the more general pictures and looking at trends of what are happening within our practices. Next slide, please. So, and also from our, it's not going to the next slide yet, or at least mine's not.
I will try turning it on and off, because sometimes there's a time delay. Did it go to the next slide?
I still have our mission statement on here. But I can keep talking while you try and figure.
Yeah, I just turned it on and off again. Does it show?
I still have the mission statement with the hand.
Okay, I'll keep playing with it. I'm showing
okay.
the results research, but I'll keep playing.
I see the results too. I see the results too.
Okay, good.
Okay,
thank you all.
The results. So basically what we chose to do then is look at different things. So within the Practice-Based Research Network, to get a culture of research, because massage therapists here in the area were having difficulty wrapping their heads around research. I got it now. We're looking at the CARD study. I'm talking about the CARD study now. We wanted to find something that was meaningful to the practitioners in the area. And so as we put out all the things we were interested in, what bubbled to the top is how are we getting our referrals and what are they talking? Like, are they talking to their physicians about it? And so we had the group do a literature review and got some information. So we looked to see who are referring and understanding why they're not. And from our card study, we basically found that established patients within the massage or people coming for specific reasons were more likely to tell their primary care physicians about their massage. And then in our group, what we found was those people that didn't tell their physicians, it was more because they just didn't even think about talking to their doctor about it. So that helped our group empower their patients or their clients to talk to their physicians and healthcare providers that they are getting massage and how can we start to collaborate, which has increased some of the referrals and cross-communication. And our funding has stopped last May through the CTSC. So we're looking at finding something, and it looks like how Oregon has the consortium, we're looking at trying to create a membership base in Ohio to get more of the research going forward. And then another parallel to what Beth and Candice were talking about, in my works with the Center for Reducing Health Disparities, they had a community research scholar program that I became part of, and it was creating research capacity within nonprofit organizations. And I kind of fell into that as somebody dropped out. So as part of that, we learned research methods and had to create a research project, and mine was the perceptions and barriers to massage therapy at 5 federally qualified healthcare clinics. So we found in there, we wanted to find out what the perceptions and barriers were and possible feasibility. And the biggest thing we found was cost was the biggest barrier, but the next things from cost were location, finding a place to go, and knowing who to go to, which will be informative for the profession and our area, and knowledge of massage. What people utilize massage mostly for were back pain, stress, anxiety, and chronic pain, which goes along with the research and helps strengthen that. And experience with massage, 77% of people had massage, but only 53 from licensed massage therapists in the area. So it was a lot of family members and friends providing massage, especially in the lower income areas. But the perception was really amazing to us too, as far as people looking at massage as healthcare or a luxury, or the other was inappropriate. We found it equal healthcare to luxury, and not many, I think it was like 5 people looked at it as inappropriate or sexual. So that was another big thing. And inner city urban population had a higher level of looking at it as healthcare than the suburban clinics did. So next slide. And so some of the things from my experience here, since I am a community member practitioner, my big barrier is I don't have a PhD. I can't really write for grants. So I look for collaborations. I'm doing a collaboration now with Nikki Monk on writing a paper that will hopefully open up opportunities. So the practice-based research networks, we've done presentations on those 3 studies that were described, and the primary care research network is very interested in the integrative healthcare, and there's a ton of posters that are at their international conference. So I know there's openings there for interest in looking at grants. PCORI, motivating the patients and looking at what they have, I think is another opportunity, and the opiate epidemic funding opportunities for us to collaborate with. And I guess next slide. I know we're over. So I think one of the big things I'd like to looking at is the World Health Organization's definition of health goes right along with our theory with integrative health, and trying to look at fluidogenesis, generating health, versus pathogenesis and treating disease. So how do we look at the bright spots and what we're doing to create health, instead of currently it seems like a lot of research is looking at the decline and what's going wrong, if we could start changing those focuses. And next slide. Any questions? I just put some questions out there. Turn it back over to Beth, Candice, and
Thank you. Yeah, and
anyone else.
thank all of you. This is Beth R. And these are also fantastic questions, discussion questions that we can certainly address in future meetings. So I thank you. We are just 2 minutes over. Are there any questions for those of you who can stay on for Beth, Candice, and Diane? All right. Well, I thank our presenters. I thank everybody who is on the call today. We will post this recording on our website, and if you have any questions that for our presenters, you can certainly email them to me. If you don't have their emails, then I'll pass them on or email them directly. And remember, our next meeting is coming right up on April 2nd. It'll be another joint meeting. And I look forward to seeing everybody there. And let me know by email if you have any questions or comments in the meantime. So yes.
I just want 2 comments. The WHO definition goes back to the 40s. It was only slightly revised. Isn't that kind of amazing and interesting? Still is used throughout the world, including at the National Academy of Medicine. And the other thing is that NIH, now called NIH and CCIH, has actually been funding comparative studies for quite a while because, again, back when Richard Hammerschlag was at OCOM, it received 2 of those, where it was actually doing comparative studies in terms of different disciplines treating the same condition. And I think that that particular approach can be very effective with our disciplines. So they are moving more towards being open. NIH is moving more towards being open to whole systems approaches and comparative approaches. And I know that David O'Brien, the ACIH chair, and I will soon be meeting with the interim director of NIH CCIH and seeing what is going on in that particular area. So thought you'd like that, to know that, because there are some interesting grants, including on issues of the opioid crisis, that are now available to apply for. So those are great collaborative grant projects.
Thank you, Liza. Thank you, Liza. And I just want to read 2 comments that we received in the comment box. Thank you. This was fantastic. And that was excellent. Thank you for sharing such rich experiences and information. Much to consider. That's great. This was a fantastic presentation. Any other questions or comments before we end the call?
Beth, this is Beth.
Yeah.
I know I'm part of the reason we went over because really there's so much richness in this area. I'm sad we don't have a chance for Q&A. So I would love to request that at the next joint meeting, these reflection questions are something we might bring up in the roundtable. I would love to be able to talk more, but I know we're now 5 minutes past time.
Yes, I will definitely put them on a future meeting. I'll look at the agenda for next meeting. I think we can do that. So wonderful suggestion. Thank you.
I have a question. This is Jim Wheaton. Could someone say more about the Primary Care Research Network? What is that, and is there contact information?
The Primary Care Research Network is with the Agency for Healthcare Research and Quality. It's NAPCREG, North American, so if you look up North American Primary Care Research Group, they have a conference this year in, I think it's in Chicago, maybe in September or October, but primary care physicians, I see a good connection, especially with massage therapy. I think all integrative healthcare, their method and model of practice-based research network is very informing in small groups and looking at the complexities of each care. So I think there's areas there that could be room for collaboration and funding for groups within ACIH. Does that answer your question?
Yes, very good. Thank you.
Yes. And they're open. Like I'm going to be part of a group that I get to bring one of my patients, and they're going to come in and help with grant writing and connections and collaboration. They have a great contingency in Colorado. We're working to do some things as centers of excellence within Medicare, Medicaid, things like that. So they're a great connection. I think that's very interested in what we do as integrative care practitioners and how it helps them. They just, as we create our communication through the dissemination group, I think will be huge to tap into them.
Can we put that during the roundtable? I think this would be worth mentioning again on April 2nd. Diane, will you be on the call April 2nd?
I will try. I'm going to be in Colorado skiing, so.
Oh, okay. Well,
Right.
on the next meeting you're on, I'll put it on. Let's when we have more people and perhaps also different people who attend, then we can talk about this again because I know you've mentioned it before, and I think it's worth mentioning again.
And if people have any specific questions, email me because I'm better with specific questions than general because I have a lot of information in my head. So questions or comments help focus the information I provide.
Wonderful. Well, thank you. Thank you. We didn't go too much over for all the rich information that was shared. Thank you for those of you who were able to stay on a few minutes after, and thank you again to our presenters. Really appreciate it. Fantastic presentation. And I will talk with you all over email and talk with you again on April 2nd.
Thank you very much.
Thanks all.
Thank you.
Bye-bye.
Thank you. Bye-bye.